Hi, everybody, and thank you for joining us today. We're just waiting for a few more people to arrive before we carry on. Just hold your horses and we'll get going soon. Thank you. Okay, everybody, I'm going to make a start. Thank you very much for joining us today. This is the Nottingham CCG vaccinations before, during and during pregnancy and also during breastfeeding information public question and answer session. All information is accurate as of today, the 25th of November 2021. Next slide, please. My name's Jen Moss-Langfield. I'm a GP and I lead in maternity for Nottingham and Nottinghamshire CCG and ICS. Next slide. I'm going to take you through the COVID vaccination before pregnancy first, and then I'm going to be handing over to some of my colleagues to take us through the rest of this. So, starting off, I'd like to reassure everybody that there is no evidence that any COVID vaccinations affect fertility for men or women. Initial studies that didn't recruit pregnant women, of course, but there were many accidental pregnancies that occurred. And by accidental, I don't mean unplanned. I mean that they didn't plan that as part of their research proposal. But there were a lot of women who did become pregnant. So we've been able to look at those numbers, the number of people who were vaccinated versus unvaccinated, to see whether there were any effects of that. And the good news is that the chance of conceiving is unaffected by the vaccination, as is the chance of miscarriage. That's also unaffected by vaccination. And importantly, no ingredients cross the placenta or are known to affect fertility, which is a really reassuring situation to be in. Next slide. A lot of women ask, should I delay my treatment or my pregnancy until after I've had both vaccine doses? But there isn't really a reason to delay treatment or pregnancy in order to get vaccinated. It doesn't affect your chances of getting pregnant or miscarriage, as I've previously said. It is just as safe to be vaccinated before pregnancy or during pregnancy itself. The safest is to be fully vaccinated by the 3rd trimester, if possible, because that's the highest risk time for a pregnant woman. One vaccination gives some benefit, but if you get a full course of the 2 vaccinations, or actually including the booster vaccination now, that gives you much more protection. Next slide. A lot of women also ask about will vaccination affect menstrual cycles, periods? And previous research has found on other common vaccines, such as the flu jab and the HPV vaccine, that they can cause short-term changes in the menstrual cycle. And we don't know exactly what the mechanism for this is, but it possibly is to do with mild fever, commonly seen after vaccination, or some unknown mechanism. Therefore, it's really unsurprising that there have also been reports of these minor cycle changes occurring shortly after COVID vaccination. Interestingly, there are also reports of cycle changes occurring after COVID infection also. So whether the actual direct correlation to the COVID vaccination is definitely not there. It's quite often, I think that the menstrual cycles are essentially a little fickle and like to go off and do their own thing every now and again. As with other vaccines, the effect seems to be really limited to just 1 or 2 cycles, and there's no suggestion it will be associated with any long-term problems. And we do have the experience of the flu vaccine and the HPV vaccine, which have been going on much longer, to back that up. Next slide. So vaccinations in pregnancy. They're very good at protecting against moderate and severe COVID infection. And it can also give protection to the baby once it's born, because the antibodies that are generated by vaccination can transfer across the placenta. None of the ingredients can go across the placenta, and the vaccination cannot give any woman or a baby COVID-19. And none of the vaccine ingredients are known to be harmful at all to pregnant women. Next slide. So it is safe. Also, at any stage of pregnancy, there's no increase of risk of miscarriage or preterm birth or stillbirth or birth complications or congenital abnormalities or growth restriction of the baby have been found in the COVID-19 vaccination research so far. And that's evidence from 11 studies in 5 countries, including more than 81,000 women. Next slide, please. Every woman is eligible. Every pregnant woman is eligible. It is extremely rare for anyone not to be clinically suitable for vaccination. But hesitancy is the prime reason for pregnant women to be either unvaccinated or only partially vaccinated. And that's because people have a lot of questions that they want to answer. And that's why we put this session on today. Pfizer and Moderna are the vaccinations we use in pregnancy. The reason for that is that there's really good evidence demonstrating their safety that we got because they were used over in America first. There, they didn't have any of the other vaccines going. So we've got the most evidence, and that's why we've chosen to use those in this country for pregnant women. Next slide. So the vaccination program overview. The rough schedule is that you can get your dose 1. That's at any stage of pregnancy. And I would emphasize, we do want that one as soon as possible because the COVID rates are reasonably high at the moment. We do then have the second dose after 8 weeks. Initially, it was 12 weeks. It was brought forward because the COVID rates were quite high. There's also a third dose for those people who are immunocompromised when they were taking the first 2 doses. And that's after another 8 weeks for those people. It's a small number, but very significant at-risk cohort of people. Then there's now a booster program that's 6 months after the last dose, which would be either the second or third dose of the initial course. Next slide. So why is there a booster program? So a study that was done by the UK Health Security Agency, which is formerly known as Public Health England, has found that immunity was waning. And actually the protection of the over 20s after the second dose was for those who had 2 AstraZeneca vaccines, only 44.1%, and 2 Pfizer's was only 62.5%. But what they found, and this was when this is in the over 50s, because that's what we've got the evidence for the booster program, how effective it is. But there's no reason to think it wouldn't be exactly the same for anyone younger. Is that the protection after having a Pfizer booster 2 weeks later, if you had 2 AstraZenecas as your first 2 vaccines, then you had your Pfizer booster, you get to 93.1%. And if you had 2 Pfizers followed by a third Pfizer, it's 94%. And that is amazing. That is really, really great numbers. And it just really goes to show just how important not only having your first 2 vaccines, the initial course, but then to have that booster now, because for some people it may be quite a while since they had their first doses. Now, let's take the next slide, please. Where can women get vaccinated? So this is pregnant women. There is an offer available only to pregnant women, and that is antenatal clinic. So when any pregnant woman has a scan or an appointment in antenatal clinic in the hospital, they can have their vaccination done then and there. So if you're interested in that, there will be people going around asking you, but you can just indicate that you would like to get vaccinated there. You can also book online. The vaccination centres, there are lots of them around. Now, if you go to either Forest Rec or the Mansfield Vaccination Centre, you can speak to a GP if you have any questions or concerns, and you can have that one-to-one, face-to-face conversation about what that is to you, what it means to you to get vaccinated. We also have the hospital hubs where you can also get vaccinated in addition to the antenatal clinic. And then we have community pharmacists, so pharmacies. So you can book online or any of those options. We have a walk-in offer at Forest Recreation Ground and the Mansfield Vaccination Centre. You can walk in, you can have a little look at some of our information. I'll go on to show you the web link, and we will put it in the chat as well, so that you can have that the knowledge of how and when, where you can get your vaccines. You can also contact your surgery. So we have primary care networks, which are groups of surgeries, and we've based a service around these. So if your GP is doing the vaccinations, you can have it done there. If they're not, they can direct you through to and book you in at the GP surgery, which is very local to you, and you can get your vaccination done there. So those are your options for getting the vaccine done. Next slide. So we've just had a little picture of where all of these are. You can see that we have our big, large vaccination centres, which are in the hospitals, and Forest Rec and the Mansfield Vaccination Centre. We also have our pharmacies in green and our GP practices, those PCN-based ones, so the main practice that's doing all the vaccination are in yellow as well. Okay, if you to find a full list, you can visit the website. We're going to pop it in the chat so you can link to that. Next slide, please. So I also want to bring your attention not only to COVID vaccination, but also about flu vaccination for you and your family. So flu vaccination is especially important this year because over the last year, we haven't had any flu at all. So any of our normal immunity that we would have, and we top up every year with exposure to vaccines, has dropped right down. So there's never been a year that's more important to get your flu vaccination. And we know that flu is really serious in pregnant women there, and also other members of your family. So unlike COVID, flu can affect children quite badly. And obviously we know that flu affects vulnerable members of our society, but quite severely every year, apart from last year. So the people who are eligible for the vaccine include any woman who's pregnant. So please consider yourself invited. Also, children 2 to 15. The 2 to 3-year-olds can get vaccinated in their GP surgery, but those school-age children can get that done at school. If you have certain health conditions, you may also be vulnerable and therefore qualify for a new vaccine, flu vaccine. Anyone who's 50 and above, and that's the same as last year, it's really important to come and get vaccinated. Also, if you're a carer receiving carer's allowance, then you can come and get vaccinated. Or if you live with someone who is more likely to get infection, so people who are very vulnerable themselves and have what we would call immunocompromised, so someone who has HIV or had a transplant, or certain treatments for like chemotherapy or radiotherapy for cancer, lupus, rheumatoid arthritis, any of these conditions, then it's really worth thinking about whether you also would anyone would benefit getting vaccinated. Anyone also in care homes or long stay residential care, and our frontline health and social care workers. Next slide. So I've talked about this briefly before, but from 6 months to 2 years of children with long-term conditions can get that in your GP surgery. Also from 2 until primary school, that's your GP surgery. All children at primary school, all children at secondary school, up to year 11 can get vaccinated. And then if you have any children who have long-term conditions can also get that offer at their GP surgery. Homeschool children, there is a community clinic that is put on for those children. Next slide. So, if you're pregnant, you can access your free flu vaccine at your GP surgery, but also at your antenatal clinic appointment. You can also get your whooping cough vaccine if you're over 16 weeks as well. And there's a pharmacy service that's also offering flu vaccinations. So lots of opportunities there for you. Next slide. I'm going to hand over now to Andre and then Susie, who are going to take us through COVID itself in pregnancy.
Hello, I'm Andre Ellis. I'm one of the consultants at NUH and the COVID lead. I just wanted to talk to you about the risks of COVID-19 infection during pregnancy. It has become increasingly evident that pregnant women are a particularly vulnerable group for COVID-19 infection, particularly in the second half of cycle of the pregnancy. Our most recent data, which was collected by the RCOG, shows that between February and September of this year, 1,174 pregnant women were admitted to hospital sick with COVID in the UK, and 98% of them were unvaccinated, and the rest were only single vaccinated. Of those, 14% were admitted to intensive care, and there were significant effects on their pregnancy outcomes as well, because 43% ended up with caesarean section, and 24% had COVID pneumonia, 21% required respiratory support, and really sadly, about 0.4% in this way, 13 women died. The next slide, please. So the implications for their babies is that 21% of babies were born prematurely, required admission to the neonatal unit, and also 1% of women who had COVID during pregnancy had a stillbirth. So in comparison to other waves, in the first wave, 9 women died, and the second wave had 11 women died. But in this wave, the Delta variant seems to be particularly dangerous for pregnant women, and also seems to be more likely to target the placenta. 11 women died, despite the fact that we have vaccination available. And this is, as you can see from the admission figures, is secondary to the fact that there has been poor uptake of the vaccine programme by pregnant women. Next slide, please.
So looking at our local data in Nottinghamshire, we are no different to the national picture, and in actual fact, the Midlands has been particularly challenged by high COVID rates. We're seeing increasing numbers of women testing positive in pregnancy, and that's secondary to all of the measures that were put in place in the first and second waves being gradually dialed back. So schools are open, there isn't a national lockdown, there's far less mask wearing and far less social distancing. So all of the things that we put in place to protect ourselves are gradually being eroded, because the hope is that the uptake of the COVID vaccination programme will help protect us. And unfortunately, with the hesitancy within our pregnant population, that means our most vulnerable group now are pregnant women. And most of the women who have been admitted to hospital and to the intensive care unit with COVID remain completely unvaccinated, so very similar to the national picture that Andre just described. We're seeing really huge pressures on our neonatal units, so with a significant number, so 1 in 5 women who give birth with COVID give birth preterm, and 1 in 5 of those babies that are born to women with COVID are admitted to our neonatal units. There are incredibly long distances to travel for available cots, particularly at the real extremes of being born very early. Next slide, please. So what happens if you are well with COVID and you test positive around the time that you go in to give birth? So we know that most fit and healthy young women will be relatively not poorly with COVID, but it does still have a significant impact on what you thought your birth and your immediate postnatal period might feel like and might look like. So your experience changes really significantly. So all women are tested on admission to hospital for any means of giving birth. So if you're coming in for a planned caesarean, for an induction of labour, or if you go into labour spontaneously, you will be tested. So we will know whether you have COVID or not. And if you do test positive, it has a real impact on what then happens. So just as for any person who tests positive, you then are isolated. And that means that that period of time during your birth and then afterwards, you can't have visitors. You can have a birth partner when you're in active labour, but only if they're not COVID positive as well, because they'll require to isolate too. And if your baby does require a stay on the neonatal unit, they're isolated as well. And in some circumstances, particularly those where both parents are COVID positive, you wouldn't be able to visit your baby on the neonatal unit because there is a real priority to protect the health of the other babies that are there and incredibly vulnerable. So it means that you could be potentially separated from your baby whilst you're isolating, which is incredibly difficult. So really wanting to give a flavour of what being COVID positive in pregnancy and around the time of your birth might feel like. And I think it really doesn't add up to being the sort of experience that any of us would want for ourselves or for anybody else that we're providing care for. So reasons for us to want you to think about having the vaccination to avoid putting yourselves in this position. Next slide, please. I'm going to pass over to Natalie, who's going to talk around some of the issues around concerns with breastfeeding.
Hi. Next slide, please. So this is just some data and information around breastfeeding and chest feeding during this time, because there are slight adaptations that you might be interested in. So the main message to get across is if you're breastfeeding or chest feeding your baby and giving them your milk, you don't need to stop doing it to be vaccinated against COVID-19. So if you choose to have the vaccination or you're considering to have it, you don't have to stop that relationship between you and your baby with giving them your milk and providing that protection, nutrition and comfort for them. So the World Health Organization states that vaccinating a breastfeeding parent to protect them from COVID-19 doesn't hold any risk towards your baby. And this is something that parents are obviously going to take into consideration. What you can do is you can choose to have any of the 3 licensed vaccines and continue to feed as normal. Now, the reason this is okay for your baby is because there's no plausible mechanism by which any of the vaccine ingredients can pass through your milk to your baby. There's just no way that it can physically pass through. So that's quite a reassuring fact, I think, because that's something you're going to be considering. And the main thing to remember about breast milk and human milk is that it offers the nutrition for your baby and comfort, which is super important, but also protection, because breast milk has live constituents in it. Now, these include immunoglobulins and antiviral factors. And what these do is they help destroy harmful pathogens and they boost your baby's immune system, which is why we talk about giving breast milk to babies, especially babies who are born early, like we've been mentioning. It's vital that they get breast milk. Now, one of the other things that's quite interesting about the vaccine is that there has been studies done to see what happens when someone has the vaccine and continues to breastfeed and what happens to their milk. And what's been found is in this study in the graph on the right, is that people who have had the vaccine have found that the antibodies that their body create does get passed over to their baby, which is really, really interesting that actually, although the vaccine itself doesn't pass over, the benefits from the vaccine, the antibodies pass over and can potentially be positive for the baby. I'll pass on to the next slide.
So we are aware that there's been a lot of misinformation that's been circulating around the vaccine, and we just really wanted to make sure that you knew about some information that comes from credible sources before you share onwards. And so we've given you some examples, and we're going to pop all these in the chat because I do know that these hyperlinked things on a screen that you can't actually click on aren't as useful. So as we speak, we will be popping these into the chat for you so that you can actually access these. But we have a NOTS CCG account, so there's a telephone number that you can phone if you have any inquiries. We also have some really good NHS websites there. I'm not going to go and read all of these out for you. There's also some government websites, and the Royal College of Obstetricians and Gynecologists, the RCOG, has got some amazing resources there. So you just need to be able to Google RCOG and COVID vaccine, and you get through to some brilliant FAQs, frequently asked questions. There's also an amazing webinar out there, British Fertility Society fact sheet. You've got some great resources from BBC Asian Network, as well as our own CCG social media pages. Next slide. Now, the main purpose today is to allow you to have your voice and ask your questions. So I'd like to open this up to everyone out there to pop your questions into the chat, into the Q&A bit, so that we can then go through and answer some of these questions for you. Okay, I'm going to ask Katie just to give us some questions to answer.
Thank you. Thanks to everybody that's presented today. We've had a question around long-term studies. Have there been any long-term studies to say that the COVID vaccination is safe in pregnancy, breastfeeding and prior?
So the studies that have been going are only, none of the studies can be longer than COVID itself. Many of them do use the evidence from previous vaccine trials as well to supplement some of the longevity data. But we do have some very good, all the evidence is showing that the vaccines are safe. We have cited some of the information, the research trials in the presentations, and what I'll do is I'll pop those into the chat. I'll get to Sarah to pop some of those into the chat so that you can also have a little look at those that evidence. I'm also going to hand over to one of the obstetricians here to get their secondary care point of view on this one.
So I think, as Jen said, specific to COVID vaccination, the COVID vaccination has been around for just shy of 12 months. So the long-term studies will follow, but the data that we've got from women who have given birth and from women who have been pregnant whilst they've received the vaccine has demonstrated absolutely robustly no increase in vaccine side effects, no increase in adverse outcomes, no increase in complications. What we have seen, however, is a massive increase in complications related to COVID infection. So what we are looking at is a robust, safe means of protecting vulnerable women and their babies from a disease that does increase their chances of harm. And as Jen said, the vaccine safety is well established, and we have a vaccine for flu that changes every year based on the specific strain of flu that we have. So if you like, those are new vaccines that we're administering every single year to people with very, very robust safety data sitting behind it. The whooping cough vaccination programme is a completely altruistic vaccination programme because the mothers aren't taking it for benefit of themselves, they're benefiting their baby by passing on that immunity to them. There is no mechanism by which it protects mums over and above because they've usually been protected themselves. It provides that cover for that gap until they have their routine immunisation starting at 8 weeks old. So we are already doing vaccinations for the benefit of babies, and this is a similarly linked one where we've seen that vaccination provides that immunity that passes across the placenta, but nothing else does.
Thank you very much, Susie. I think you put that really succinctly, and I just want to emphasise the fact that we know how dangerous COVID is to pregnant women and the outcomes to babies as well. And I think that's something that doesn't get really highlighted. Everyone is asking about what the safety data for the vaccine is and forgets what the safety data for COVID itself is. And we have a very big balancing act. And on one side, we have horrendous harm. And on the other side, we don't have any evidence of harm there, but we do have a lack of the really long-term studies, as you do at the beginning of anything. But I think that we will find that will carry on showing that very big tipping of the balance in favour of the safety of the vaccination for mother and baby. Next question, Katie.
Yep, I hope I say it right because it's a clinical word and I'm not clinical. So I have a question in relation to pregnant women who have thrombophilia with a history of PE and known genetic mutations and who take daily injections during the pregnancy and postpartum. Is COVID vaccination safe for them during pregnancy?
Yes, it is. Now, there was a little bit of concern about a particular type of immune response to the AstraZeneca vaccine, which caused some women, well, some people in general, to get an immune response which caused low platelets and increased clotting. But that's not related to any of the underlying conditions. In fact, underlying conditions like described there put someone at incredibly high risk of clotting problems, blood clots, for example, in pregnancy itself, but in COVID infection. And if you combine all of that together, that is a really high risk person. And actually, it's just the sort of person we would want to be protecting with the vaccine. We also don't administer the AstraZeneca vaccine in pregnancy, not because we think that that's unsafe in pregnancy, it's just we do not have the same amount of data as we do with Pfizer or Moderna. We don't give the AstraZeneca vaccine to anyone who's under 40 either, which is the majority of most pregnant women. So I would be recommending that person to go and get a Pfizer or Moderna vaccination, and I don't think there's any increased risk of thrombotic events, which is blood clots, to them, but there is a clear benefit. Andre?
I was just saying, Jen, obviously just picking up that point about the AstraZeneca vaccine, and if you've had one AstraZeneca vaccine, which is when that particular complication presents, there haven't been any cases with a second AstraZeneca vaccine, and therefore the recommendation is that if you're pregnant, when you require your second AstraZeneca vaccine, to go ahead and have that and complete your primary vaccination programme.
Yes, here in the UK, we've actually had quite a lot of pregnant women who have had both doses of AstraZeneca when pregnant, and we don't have any evidence that that's harmful. However, I would advise you to go and have a little chat with your vaccination centre, with the GP who's there, who has all of the information and can go through that with you, or go to antenatal clinic and have a chat there with your obstetrician, or you can have a chat to your midwife, or your GP, your own GP. There are so many people out there who will have that information. The more specialised you go, so your obstetrician or the GP at the vaccination centre, you're probably going to get more information. Next question, or has anyone else got anything to put in on that one? Oh, Natalie. Oh.
Sorry, I just wanted to add something that was not related to that. It was to talk about side effects. Someone's asking in the questions about side effects. With regards to breastfeeding, there has been very few side effects reported, but some women have reported altered, it's anecdotal, so it's not registered. So anecdotal symptoms of mastitis and altered milk supply, but it does say the information we've got that the reports of adverse effect are limited. So just to answer that. And someone was asking in the comments what chest feeding is. It's just an alternate term, so it's inclusive for all parents who might not identify as women or might identify as non-binary. So as part of being midwives, we have to give individualized care that accepts everyone's feelings and how they want to be treated. So it's just a really good way of making sure everyone's covered by this talk.
Thank you, Natalie. Now I'm going to, Katie, do you have any more questions to go throw at us?
Yeah, we've had some just submitted beforehand for people that couldn't attend, Jen. So I'm just going to put these open these up now, if that's okay.
Fantastic. And if you do have more questions, please do pop them in the chat. We are here to answer your questions. You've got a GP, 2 obstetricians and a midwife, captive audience here. So chuck your questions in for us, please. Katie.
Yeah, so I had the Pfizer dose before I knew I was pregnant, and my second dose is due just after my dating scan, when I believe I would be around 13 weeks pregnant. Should I try to delay a second dose until after the scan?
I'll let Susie take this one.
No, absolutely fine to have it as soon as you are due to have it. And to quote Professor Thornton, who's done some of these previous webinars, the best time to have your vaccination is 8 weeks ago. The next best time is today. So as soon as you can get it booked in, there isn't any recommendation to wait for a certain stage of pregnancy. The safest thing is to be fully vaccinated.
And if it happens to be due when you go for your dating scan,
get it done then.
In antenatal clinic.
Absolutely.
Brilliant. So you've got an extra opportunity to get that done. We don't vaccinate people before 56 days, not 56 weeks, 56 days. The reason for that is that there's really good evidence that having a slightly delayed vaccination between 1 and 2 gives better and longer lasting immunity. And that is really important for you as a pregnant woman, because you want that immunity to be there when you're giving birth, as well as protecting you through your pregnancy. So we don't want you to get vaccinated before 56 days with that second dose. We want you to be coming in at 56 days there. And we've been proven right with that vaccination technique. There's been a lot of challenge about why we weren't doing that second vaccination at 3 or 4 weeks. But actually, if you look at the rates in Europe compared to where we are, that was a good, very good evidence-based decision that they made, and based on the science, which is where we like to be. Katie, what's the next question?
Yeah, we've had a couple of comments in the Q&A around the yellow card scheme, Jen. Would you be able to allude to what the yellow card scheme is, please?
Absolutely. So the yellow card scheme is where anyone can report an adverse reaction to any medication. Now, we use this, so if you've had a funny reaction, you think, to a paracetamol, you can use the yellow card scheme to report that, so people are aware. And it's a good act. So you as a patient can do this, I as a GP can do this, Susie or Andre can do this as obstetricians, and Natalie can do this as a midwife. It is open to anyone. And it is really important that we do gather information, because we can just build on it. The more information we have, you can see patterns that you might not be able to see if you have a number of 100 or 1,000, but when you get up to 1,000,000, or we need more. So if you think that you've had a funny reaction or something, or you're not sure, you think it could be, you can either contact your GP or another healthcare professional about it, and we could do that report for you. If we thought that, we might turn around and say, yes, we know that that's a side effect. We don't need to do a report. But if it's a weird one, then we can put it in. And actually, with the COVID vaccination program being so new, we're asked to really report everything, so they can see how frequent it is to have, for example, arm pain. I can tell you, even after just having 3 vaccinations, that was 100% for me of arm pain. But I didn't get a fever after any of my COVID vaccinations, but that's another quite frequent side effect. Most side effects we find are gone after 48 hours. There are some rare delayed ones there, but if you think there's anything's related, then you come and let a doctor or a clinician know, or just Google yellow card COVID vaccination, and you can put your own one in. Does anyone have anything to add to that? Okay, let's move on to the next question, Katie.
Yeah, okay. Please, can you tell me if, having had a COVID, does this affect my future pregnancy or fertility?
So this is having COVID itself, rather than
COVID itself, yes.
So there's no evidence that COVID infection itself will affect fertility or pregnancy in the future going forward. It can make periods wonky, as I've said before, just like, rarely you can get that from the vaccination or any other vaccinations as well. But I am not aware of it affecting fertility. I think that when I'm talking about that, I would be talking about a normal COVID infection. Of course, if anyone has an incredibly severe infection of anything, then there are potentially other consequences going on. But hopefully the people who are so severely affected by COVID are few and far between, especially when we're thinking about our young and healthy population. Would Susie or Andre like to chip in as well, please?
Just to clarify, are we talking about the effect on if you have COVID during pregnancy, what the effect would be to your ongoing pregnancy?
It sounded to me like it was talking about pregnancy in the future, but Katie, have I misheard that?
No, that's right, Jen. It is. It's pregnancy in the future if somebody has tested positive for COVID.
So there is no evidence that having COVID affects your fertility or pregnancy, so reproductive performance in later life. No.
In fairness, though, with long COVID, it's difficult to know what those long-term effects on your overall health might be, and whether there are some subtle changes that having COVID can then lead on to in terms of your well-being and your general health. It would be difficult to say, but we haven't got enough data, I don't think, to be able to say that a COVID infection here and then a pregnancy over here would have any negative effects so far.
Right. Yes, I would agree with you there, Susie. I mean, obviously, if you've had severe COVID or if you've got long COVID, then obviously there are implications, because you've still got ongoing illness and symptoms, haven't you, likely. But assuming you've fully recovered from your COVID infection, there shouldn't be an effect in later life, as far as we can see. But obviously, COVID's not been around that long, has it?
And long COVID is something that we are learning more and more about, and we don't understand everything by any means at the moment. So whilst I hope that this is true, that there are no consequences to fertility going forward, I wouldn't stake my career on it, because we don't know, and we know that it's the gift that keeps giving, unfortunately, with long COVID. We're learning more and more how horrendous it is to have that as a person, emotionally and physically. Katie, have we got another question to move on to?
We do, yeah. Probably one for Natalie. It's around breastfeeding. So it's when I go for my vaccination and this individual is currently breastfeeding, do I need to have a specific jab, or all okay? And do I need to make them aware that I am breastfeeding when I go for my vaccination?
You can have any jab, that's fine. And I think it's good to mention it anyway, just because it tests that person's knowledge, if I'm quite honest. I know when I went for mine, I mentioned it just to see what they told me. Keeps us on our toes. And I think sometimes it's really good to be open anyway. And also, if it's something in the back of your mind that you're a bit concerned about, you can sort of think, oh, actually, I've mentioned it now, haven't I? I haven't kept that. But you can keep it to yourself as well. You don't have to declare it. One thing I would say about vaccination, if you haven't been vaccinated yet and you did get COVID prior to going for it, then you shouldn't be separated from your baby while you're here. We would isolate you together, and you could still provide express breast milk. But obviously, if you then decided to go and get the vaccination, then go for it, and it's absolutely fine to get any three.
Absolutely, I would completely agree with Natalie there, that it is a very important thing. We don't ask about breastfeeding. I was breastfeeding when I had my first AstraZeneca vaccine. I had 2 AstraZenecas and then a Pfizer booster. And initially, all the information was, and this is one of the reasons why I have such hesitancy, is initially all the evidence at the beginning was a bit lacking, and the MRHA made an initial decision that pregnant women or breastfeeding women or women who were deciding whether to get pregnant in the next 3 months shouldn't be vaccinated. Now, that was changed at the beginning of the end of December. So only a few weeks, it was like for 2 or 3 weeks that was the situation. But it made a lot of women really worried about this. And it got people starting to think, well, I'm going to get pregnant in a few months. I can't get vaccinated. I am pregnant. I can't get vaccinated. I'm breastfeeding. I can't get vaccinated. But actually, that is old information. It's nearly a year out of date now. We know now that is not the case, and that with the Delta variant especially affecting pregnant women more, it is more dangerous for pregnant women to get vaccinated than we already thought. And we thought it was pretty dangerous before, but it's just a worsening picture of that. So I understand the concerns after having lived that myself. I would really want you to go and speak to someone about that if you have any concerns. So you can speak to your health visitor about this, you can speak to your GP, you can go to the vaccination centre and speak to a GP there, or if you are pregnant, you can go to antenatal clinic, but don't rock up if you're not pregnant. I think I wouldn't be liked if I suggested that. But please do ask if you have got concerns. Next question, Katie.
I'm just looking through the questions now. So a lady, somebody has commented about somebody they knew in February, and apparently they had the jab and lost the baby soon after. Is this an effect that COVID vaccinations can have?
No, I'll take this one and then go on to one of the obstetricians. So there's no evidence there's an increased rate, but women do miscarry. There is a background rate of miscarrying, and sometimes that will happen before or after an event in life. And as women, we're terrible for blaming ourselves. We always look as to what you could have done differently. What could I have done differently? What could I have done to prevent this happening to me? This is my fault. And it's a very human nature thing to do, that we internalize things, because it's not a nice answer to say that this just happened. We don't find it satisfying to ourselves. We weirdly prefer to flagellate ourselves a little bit so I just wanted to put that as as someone who's been through a miscarriage myself and has questioned what I could have done differently, and we know whose fault was it. But I'm going to hand that over to the obstetricians now for their opinion on that.
So I think, as Jen says, miscarriages are sadly before 12 weeks incredibly common, and 1 in 5 pregnancies will end in a miscarriage. So that is a huge number. And unfortunately, pregnancy loss throughout pregnancy isn't as rare as we would like. So you can lose a baby up to when you would expect it to be born, in around 1 in 225 pregnancies. So that isn't as rare as we would like. We just don't talk about it enough. So to have one event following, or one event after another, doesn't necessarily mean one caused the other. And back in February, we weren't recommending vaccination in pregnancy. So it's really unfortunate that these things were linked in that person's mind and then in yours. And I've seen another question that's talked about spontaneous abortions, and I just wanted to clear up something about the language. Spontaneous abortion is a really old-fashioned term for miscarriage that we use. So they aren't different things. And we are really clear with the evidence that we've got from these huge numbers of women who have had vaccinations in their pregnancies, that there is no increase compared to the background rates. It's just, I'm really sorry that your friend had that experience, because it is an awful, awful thing to go through.
Don't think we've got any more questions that have come through, but I know that Jane has put our email address in the chat. If anybody does have any further questions, we can put them to people and get answers back to people. So I'll hand back to you, Jen, for closing remarks.
Okay, I'd just like to thank everybody for coming here and listening to us tell you about some of the vaccination and asking your questions, because without the questions we can't give any of the answers. And I hope that the answers that we've given have been enough for you, but if they haven't, please get in contact. We can give some more detailed responses. We do want people to be able to have their questions answered as much as we can. Now, sometimes we won't have as much evidence as we would like to be able to, but that can evolve, and we can then produce some more of those answers later. We will continue to carry on giving these questions and answer sessions as new evidence comes along, and we can be able to reassure people more and give a much more balanced picture. So if I think back to when we first did our first public maternity question and answer session, I think that was back in April, how things have changed, how the guidance has changed, how we now recommend every single woman gets vaccinated, and how we now know how bad the Delta variant is. So it's a real moving feast. So I just want to thank you all for coming and listening to us, and I want to thank my fellow presenters for their time there. We're all very passionate about making sure that women get the information so they can make their informed decision about what is right for them. And we know that there's so much misinformation, so we just want to be able to answer your questions as best we can. Thank you so